Hi, I am Dr. Pallavi Kalghatgi. I work at Xenith Advanced Fertility Center as a senior IVF consultant and gynecologist. We have our centers at Wakad and at Koregaon Park. Women's health is much spoken about these days, but yet very much forgotten, isn't it? As women, we need to prioritize our body and our mind, and we need to take control of our health. With that thought in mind, it brings me to today's topic, that is the Pap test or the cervical cancer screening test. You may also consider this as a gentle reminder to go and get yourself screened if you haven't recently. So basically, what is the Pap test or the cervical cancer screening test? It is a test that helps us detect the changes that occur in the cervix before it has been or before it reaches the stage of a full blown cervical cancer. The cervix is the opening or the mouth of the uterus, and it is hidden inside and we cannot see it externally. The cause of cervical cancer is the HPV, that is the human papilloma virus. Now, the HPV has many types, almost 200 and more, but there are about 14 types that are considered high risk and that can cause cervical cancer. Now, the HPV can be transmitted through the sexual route, that is vaginal or anal. It can be transmitted through the oral route and also skin to skin transmission. And HPV can occur both in men as well as in women. Now, most women who are sexually active are affected or infected by HPV sometime or the other. But most of the times it is almost symptomless. In fact, the virus or the infection caused by HPV gets resolved by itself in most cases, especially if you have a very healthy immune system, it gets resolved by its own. But in some cases where the infection is not treated or if it is more severe, it can start causing changes at the level of the cervix, and they are termed as precancerous lesions because if this kind of change in the cervix, in the cervical cells remains untreated, this keeps progressing and eventually turns into cervical cancer. So our main intention to do the Pap test is to detect these changes that are present. Who can be at an increased risk for cervical cancer are women who smoke regularly, who are cigarette smokers, uh, who have had early sexual activities, who have had multiple sexual partners, who have had untreated sexually transmitted diseases, who have a weakened immune system, who have an existing cancer. Such patients have a weak immune system, or in HIV infected women. The various types of cervical cancer screening. So there is the Pap test, there is the HPV test, and there is the co-testing, that is the Pap plus the HPV test. Now basically the Pap test is going to detect the changes in the cells or the abnormal cells at the level of the cervix, whereas the HPV test will actually detect the virus that is present at the cervix. And the co-testing includes both the Pap test as well as the HPV test. How is a Pap test done? So basically, you will have to go and visit your gynecologist. Okay, she or he will do an internal exam. The doctor will do an internal exam. Following that, a vaginal speculum will be inserted. The main purpose of this speculum is that it will spread out the vagina so that the cervix or the opening of the uterus is exposed. After that, a wooden spatula, or a brush-like instrument, it's called the cyto brush, is used to collect the cells at the level of the cervix. Now, these cells are either collected in a fluid like, or in a container that has fluid, or there and then a smear is made by the doctor and over a slide, and it is sent to pathology to for further checking. The pathologist basically checks the sample to see for any cancerous or precancerous cells in the sample. This same sample is used to check for the human papilloma virus. Is the procedure painful? No. The Pap test is not painful. Of course, the woman will experience some amount of discomfort because of the speculum that is going to be inserted and used to spread the vagina. So there will be some amount of discomfort. The procedure usually takes not more than 5 minutes, barely about 2 to 3 minutes. The right time to do the procedure. Whenever the woman is not bleeding, she can get the test done. Of course, nowadays, even when the woman is having her period, the Pap test can be performed. However, it is very uncomfortable if the woman is already in her period and is in some mild and is having mild abdominal cramps. It becomes a little uncomfortable. So we always recommend to get it done when she is not having her period. Another few points that need to be remembered is that to avoid intercourse or any kind of vaginal douching or using any kind of vaginal medications or tablets or suppositories that you use to insert, should avoid all of these things at least 2 days before the test. Well, any woman above the age of 21 years, whether she is sexually active or not, should consider getting a cervical screening test done. Between the ages of 21 to 29 years, the Pap test is done every 3 years. Between the ages of 29 to 65 years, there are 3 options now. Either a Pap test can be done every 3 years, or the HPV test can be done every 5 years, or most recommended that the co-testing, that is the Pap as well as the HPV, can be done every 5 years. A woman who is more than 65 years, there is no need to get further screening tests done, provided the previous Pap reports have had a negative report. Now, when a woman who has already has a history of cervical cancer, or if she's had a history of positive or significant Pap smear tests, or if she is an HIV positive woman, she should consider getting the screening test done more frequently, and that can be well guided by your gynecologist. Also, a woman who has had a hysterectomy, that is the removal of the uterus, may or may not need screening. Now, this is completely dependent on what kind of hysterectomy was done, whether the cervix was removed or not, and also what was the indication behind this hysterectomy. And that again can be well guided or well identified by your gynecologist. Another commonly asked question is that, is a Pap smear test needed if you are not sexually active anymore, or if you are not had any kind of encounter or sexual intercourse before? Do we still need a Pap test? Well, yes, it is needed. Firstly, because like I already told you, it is transmitted. There is there's a possibility of skin to skin transmission. There is a possibility of oral transmission, vaginal transmission, and anal transmission. So even if you've not had penetrative intercourse or sex, there is a chance of it getting transmitted still. So smear screening or the Pap test is necessary. Also, sometimes this HPV infection remains dormant and can get reactivated at any point of time. So even if you are not sexually active anymore, it is a good idea to get screened further. What happens when you have an abnormal Pap report? Well, an abnormal report does not confirm that you have cervical cancer. It is only giving us an indication that something is wrong. So when you have an abnormal pap smear report, you have to visit your gynecologist, and the further treatment, the further management will be thoroughly discussed. If you are a woman above the age of 21, go and visit your gynecologist, get yourself screened, try to understand how often you need to get screened. If you are experiencing changes or any kind of vaginal discharge or any kind of pain, please go and visit and get an internal examination done. I hope you've liked the video. If so, please hit the like button and also do not forget to share. Thank you and have a good day.